examples. After we finish school in about, I would say about 18 states in the United States, we must take a board exam, a Department of Health exam to become licensed. So that's a little bit about naturopathic medicine, but I think the overriding factor is treat the individual and treat the individual as a whole person, and then find the cause. That usually takes a lot. I know that when my patients come in, by the end I always joke that we're best friends, because I've asked so many questions, and then at the end I ask, is there anything else that I haven't asked that you think I should know? And by that time, most of them shake their heads and no.
you know everything.
Yeah.
Oh, and just that alone, and talking about the new push for the insurance companies, because they have to turn you around quickly in order to make it viable for the insurance companies to cover.
Yes, and that you hit on a point right there, is that, in the conventional world, many of their visits are 10 to 15 minutes, and the insurance companies definitely dictate that. But I believe that many patients feel as though they haven't made a connection with the doctor, and sometimes, there's even a lack of eye contact, and because the doctor is flying from one place to the other. And I also think newer doctors, and then there's some older doctors that have caught on too, but the newer doctors, conventional doctors, are catching on to the fact that there are other things that are important. For example, if someone were to come in with anxiety or depression, there are other things that are as important or accessory important to a medication, to be able to ask about their diet. Unfortunately, conventional docs don't get any more than a minimal amount of nutrition, if any. So they even if they asked about that, they wouldn't understand or know what to tell the patient. Mm-hmm. This whole idea of integration into the clinic study with your alternative practitioners is a very, very good idea for the healthcare consumer. Yeah, I just hope it continues. And, well, I know it will. As I said before, it's consumer-driven.
One of the major blocks, the pharmaceutical industries, that have spent large sums of money in order to develop products to treat symptoms. What's your thoughts on that?
Yeah, well, I think that when I was kind of describing the medical industry from the 1920s to through now, the pharmaceutical grew up right alongside the use of the more formalized conventional medicine. And yes, there is a lot of money to be made from sick people. Mm-hmm. So, yes, I agree. In fact, I was driving in Seattle. We have buses that have, you can take out an ad and put an ad on the side of a bus. And I saw an ad for cancer research, which is, with a beautiful cell. I think it was a dendritic cell, and there was another cell next to it, and about the research. And because I am a researcher, I thought, oh, that's wonderful. But my next thought was but what about the research that's done on developing the first steps in the development of cancer? What are the things that promote cancer, and why isn't there more research being done on the things to do to prevent cancer and the things that instigate cancer? There's a lot of research that's being done on once you have cancer, how can you treat it? I think that's very important, because there's a lot of people that do have cancer, not knocking that at all. But I think there needs to be an equal amount of research that's done on actually preventing Cancer is an expensive disease, from the in-hospital treatment and care, and then also the pharmaceuticals. It's extremely, extremely expensive. If we could prevent it, it would save the healthcare consumers an awful lot of money. But on the other hand, it would unfortunately put the pharmaceuticals under.
And the pharmaceutical industries, I believe, have momentum because they have been functioning with a supply and demand mentality. And yes, we're going to receive resistance for any change. However, I believe that they too can also shift and change and include in their research and in their the industry, naturopathic remedies as well.
Well, I'm hoping.
Yeah, me too. I'm saying this as a wish.
And I will say that in my clinic, we do have an ongoing clinical study that is funded by a large pharmaceutical that have to do with researching a natural formulation for a side effect of one of the chemotherapies.
Wow.
So, but it's one of the first of its kind of having a big pharma fund. It's a fairly small study. Still, it's a study. So that's encouraging.
That is very encouraging. Wow, congratulations.
Yeah, and I also have to say, and just kind of reiterate, is that I think it's not so much a conspiracy, it's the way it's grown up. When you formalize Western medicine or conventional medicine, the pharmas began to grow up just like they did. So with conventional medicine or Western medicine, we tend to look at, and I can say this because I was trained as a research scientist before I became a naturopathic doctor. Mm-hmm. We look at things in boxes. We compartmentalize. They're more mechanistic in how we look at things. And the reason why is it's easier for us to study them that way. But we know that we as beautiful, complex human beings are not boxes. And so when we try to put those boxes back together again, sometimes the theory totally breaks down because we're not boxes. And there's so more that we need to know. So having said that, the pharma, we can look at the pharma the same way, is that they are looking at things in boxes. And okay, you have this, here's this to treat. Mm-hmm. And it's bigger and bigger and bigger and bigger, and it's left out that element of, but how do we translate this into something that is more complex, that is more holistic? Mm-hmm. So I think that's the problem that you have. And also it is, it's big, and it is big money. So mm-hmm.
I guess the question always to come back to is if you were going to treat your son or your daughter, what advice would you give them, or what medicine would you prescribe? When it comes to love, we probably want the best for the ones that we love.
Well, that's an interesting question, because when my first daughter was born, I was in my 4th year of naturopathic school, mm-hmm. And she, when she was born, she aspirated meconium, which is the first bowel, into her lungs, because she had it in utero rather than outside. Oh. And when she was born, she and I had a home birth. She had problems, and when we got her to the hospital, I had a midwife though. It was a very safe at home birth. When we got her to the hospital, they said, well, she has a 20% chance of surviving unless we put her on an ECMO machine. And I said, hey, I don't have a problem with that. More in a little bit more hysterical form. I said that. And she was placed on the ECMO machine, but at the same time, I began to take certain amino acids and certain things to build up my stores of those, so that those would be transferred in milk. And then we also had a homeopath come in and a healing touch person come in.
Oh, nice.
And so we actually used both forms of conventional and also holistic or complementary medicine with her. And needless to say, which was fine with me because I felt called to do that. When you're in death situations with a loved one, you're taken someplace else, and then you're. For me, I felt as though I was called, and I needed to listen to do what I needed to do, and the sum is that the conventional doctor actually came in on his day off because she recovered so quickly. And we never told him that we were doing these other things, and all of them were very safe, particularly the energy medicine, the hands-on, and it was a miraculous thing. And from that point, I thought to myself, we have got to use integrative medicine. At that point, England was way far ahead of us with regards to the use of integrative medicine in their hospitals. But that's my conviction. I mean, sometimes the universe or whatever puts these things in front of you to strengthen your conviction and your passion.
Wow. Okay. And this is another reason why we are taking our health back, because I believe that we humans, I speak like an alien, we human beings are becoming more aware, too aware, to pretend that we do not know, that we know too much to pretend that we don't, and that we're making a call collectively, and that call is being heeded now in Western medicine, and that's very exciting to think about, and this to see progress actually being made in this area. And Dr. Lisa, before we end this segment of our interview, I always ask our guests, do you have a message that you would like to give to humanity? Your bottom line message. And what is your bottom line message, Dr. Lisa?
Don't wait for a tragedy or some huge calamity to happen in your life before you start living it and before you start loving people. Just go out, take life by the horns, look around you, what's toxic, what's not, including friendships and relationships and the food you eat, and you can get it together. So that's my message.
Wow. So start living.
Absolutely. Start living the best life that you can live.
Dr. Lisa, thank you so much for joining us today on Authenticity Radio. And will you join us again?
Oh, absolutely.
This is Slade Suter. Until next time, be authentic, be true, live your life, and be free.
This is Authenticity Radio. Authenticity Radio with Slade Suter.